Hey y'all, so I am back home after my surgery. It went pretty well. I don't have any complaints other than being sore, which is to be expected. I got there today around 11:15 and they took me back around, I want to say like 12:30, 1 o'clock. They got me back into the pre-op room and they had me wipe myself down, which my husband actually helped, thank God. Wipe myself down with the CHG wipes, and then got myself into my gown, put my pressure cuff things essentially on my calves, and everything was ready to go. And they ended up giving me a cocktail of something in my IV. That helped drastically. Like, I was calm as could be and I was feeling it. I was feeling pretty high. They also put a little patch for nausea on the back behind my ear, which is great. I had explained to them that I had, some issues previously about fighting anesthesia, and also being pretty nauseous afterwards. And they were like, well, you're a redhead. You're a natural redhead. I was like, yeah, I definitely have a lot of red in my hair. And they were like, for some reason, natural redheads tend to be harder to, put out. So, they definitely accommodated to me for that, and that was great. I don't remember anything really except for kind of getting into the OR and kind of getting on the table. Other than that, I remember waking up around, which they took me around 2 to the operating room, and then around 2:30, 3 o'clock, I was waking up in the pre-op, or post-op, sorry. It was a very quick procedure, and after I was feeling pretty good and I wasn't really nauseous, they had given me a lot of nausea medicine too. They decided to move me to the second stage of post-op, and that's where you're sitting up in a chair and they're just making sure that you're able to eat and keep stuff down, and then you have to pee before you're able to go. And I did, and my husband helped me get ready and we came home. The only things that I would have to say are pretty uncomfortable. I do have a really sore throat right now due to the tube that they put down my throat to help with the breathing. And they said that it kind of blows up right here, like kind of like a catheter where it will blow up to where it won't move out of your throat. So that's why it's sore. I have 3 incisions, 1 in my belly button and 2 on the left side of my abdomen. Very small, like, I don't know, like this wide. It's definitely sore, but the incision sites aren't the sorest part. I am having some post-op spotting, which is totally normal, according to my OB, because they did chop your tubes off of your uterus, and they have to sew that up. So there is expected to be some bleeding, which is normal. And then the only thing that's really bothering me is the air that they fill your abdomen up with for a laparoscopic procedure. They never push all the air out, okay? I don't know if it's just the fact that they don't ever push enough air out, or if it's just natural for some to be trapped. I don't know, but as soon as my surgery was over and I was waking up, I was already starting to have pain in my shoulder, and then pain in my sternum, and then pain in my right side, which is weird, but it's there. It feels like angina, where you have trapped gas and like it hurts to breathe and take deep breaths. I'll get sharp pains all throughout those areas, and it's very uncomfortable, and it just feels full and bloated. It's going to be a few days before that is, releasing and coming out the pores, which the only way it can come out is by traveling up and coming out the skin. Essentially, it just seeps out the skin. So I look forward to when it's gone. Now, they did prescribe me some heavier pain meds, but because I consider myself to be allergic to them, because I have severe reactions, I'm just going to rotate Tylenol and ibuprofen as needed and just go from that, like, there. I am really excited because not only am I not going to have to worry about another baby, but also I'm really excited about the fact that I I asked my OB if there was any way that I could see my tubes once they were out and I woke up. He said he would take a picture, and by my post-op appointment on November 5th, he would have the photos available to me for me to see them. And I'm very excited about that. I think it would be fascinating to see. And if y'all have any questions whatsoever, feel free to ask. I will keep y'all updated on like how everything goes and what my symptoms are and how I'm feeling. But again, if y'all have any questions, just let me know. I am sorry for the late update. I literally have been sleeping a little bit here and there, but mainly eating as much as I could. Like, my mom made me the brownies that I've been wanting to make for a while, and I took one of my daughter's plates and I filled it up, and that's all that was left. What was kind of funny was the fact that I was on my way home. I had fallen asleep and my husband was driving, and the seatbelt ended up right here because I was so over to the right, just passed out. My husband, I woke up to him checking my pulse because he was so concerned. So I've been sleeping hard when I do sleep, and that's the only reason why there's such a late update, because we've been home for a few hours. Anyway, like I said before, if you have any questions, feel free to ask in the comments, and I will get back to you as soon as I can about it. But so far, so good, I guess. And I hope y'all have a good night, morning, day, whatever, wherever you are, and I will see y'all later. Bye.